वीडियो बोलना कुछ।
हेलो।
अरे बाज यार देख
हेलो।
टाइप कर दो।
So, hello everyone. This is Dr. Gobind Rai Garg. तरुण इसमें मुझे बता दें कमेंट्स कहाँ हैं? नहीं देंगे। चलिए, so this is the topic of today: first order and zero order kinetics. Okay? So this is specifically meant for students who are in second professional exams. So we can discuss in little detail also regarding these topics. So what is the topic? It is order of kinetics. The drugs follow usually two type of kinetics. It may be first order, it may be zero order. So what is the fundamental thing to understand is the order of kinetics. It is first order or it is zero order. And you can remember everything from the first letter of the first order. So F here means fraction is constant. What is the meaning is constant fraction of a drug is eliminated per unit time. That means same percentage is removed in same time. Like if we consider, suppose initial plasma level is 100 and it become 50 in 1 hour. So that means in 1 hour 50% is eliminated. So that means every 1 hour 50% of the remaining drug will be eliminated. Like I can make in the next page. If it is first order kinetics, same percentage is eliminated. So if it is 100, 50% we have taken the example. So 50% will be eliminated every hour. So in the next hour 50% of this will be eliminated. So that means it will become 25. In the next hour 50% of this will be eliminated. That means 12.5. In next hour 50% of this is eliminated. That is 6.25. So that means same time, same percentage or same fraction is eliminated. On the other hand, in zero order kinetics, it is constant amount, not fraction. It is not percentage, constant amount of drug is eliminated. So if it is zero order kinetics, if I write here zero order kinetic, suppose from 100 it become 80 in 1 hour. So that means how much is eliminated? It is 20, not 20%, because it is zero order. Had it been first order, we would say 20%, but now we will say 20. So in next hour, how much will be remaining? So 20 now will also be eliminated. So remaining will be 60. Next hour also 20 will be eliminated. So it will be 40. Next hour also 20 will be eliminated. So it will be 20. You understand the basic difference? In first order, fraction is constant. In zero order, amount is constant. Now the question is why I have taken different examples. We have taken 100 to 50 here. Why we did not take 100 to 50 here? The reason is if we take 100 to 50 in zero order kinetic, so that means 50 is eliminated in one. Then next are 50 to 0. So it will become 0. So I will not be able to compare the two. That's why I did not take it 50 here. Then question is why I did not take 100 to 80 here. Had I taken 100 to 80 here in the first order, then 20%, remember 100 to 80 is 20 is gone, not 20% will be there in first order. So if 20% is eliminated, so next hour will be 20% of 80. That means 64 will remain because 16 will go. Next hour 20% of 64, that means 12.8 will go. So that amount will come in points per fraction. So that will be very difficult because we are not doing maths. Okay, we are understanding pharmacology. We are wanting to make it simple, not more complicated. Okay, so that's why I have taken a slightly different example. So you understand the basic difference. First order fraction is constant, zero order amount is constant. Okay, now based on this, you can remember all the differences between first order and zero order kinetics. The first difference is rate of elimination. Rate of elimination. That means how quickly the drug is eliminated. It is directly proportional to plasma concentration in first order kinetics. So how you will calculate? So you will see that at this point, out of 100, 50 molecules are eliminated in 1 hour. Here, out of 50, 25 are eliminated. So 25 per hour. Here, 25 minus 12.5, it is 12.5 per hour. Here, 12.5 minus 6.25, so it is 6.25 per hour. So that means every hour, 50%, sorry, the amount eliminated is different every hour. So you can see that more the amount or plasma concentration, more is the rate of elimination. So when plasma concentration is 100, rate of elimination is 50 per hour. When plasma concentration is 12.5, rate of elimination is 6.25 hour. So safely we can say rate of elimination is directly proportional to plasma concentration. Okay. If we see the same thing in zero order, you can see out of 100, 80 is remaining. So 100 minus 80, rate of elimination is 20 per hour. 80 minus 60, rate of elimination is 20 per hour. 60 minus 40, rate of elimination is 20 per hour. 40 minus 20, rate of elimination is 20 per hour. So what we are noting is in zero order kinetics, rate of elimination is constant, whatever may be the plasma concentration. So we will say rate of elimination is independent of plasma concentration in zero order kinetic. It do not depend upon plasma concentration. It do not depend upon plasma concentration. Whatever may be the plasma concentration, it remains same. So in zero order kinetics, rate of elimination is constant. Okay. So what we want to say, there is actually a formula which is called rate of elimination is directly proportional to which power of plasma concentration. Okay? So you must have heard about first order kinetics, zero order kinetics many times. But have you ever thought what is the meaning of 1 in first order? What is the meaning of 0 in zero order? The meaning is this formula. So in place of order, if we write 1, it becomes first order. If we write 0, it becomes zero order. Like if we write 1 here, it will become rate of elimination to the power of plasma concentration power 1. So that means rate of elimination is proportional to plasma concentration. So it is first order kinetics. In this case, we will write rate of elimination is proportional to plasma concentration power 0. So anything power 0 is constant. So rate of elimination is constant in zero order kinetics. Okay. Remember, there are second order, third order kinetics also. You must have studied in nuclear chemistry. When you were studying 11th, 12th, you studied nuclear chemistry. There we had second order, third order kinetics. So second and third order kinetics also exist. It is not that only first and zero exist. Second and third also exist. In second order, rate of elimination will be proportional to plasma concentration power 2. Whatever the power, that is the rate of order of kinetics. So square of plasma concentration, it is second order. If it is cube, it is third order. So it can be any order, but the drugs do not follow. Mostly radioactive substances follow, which we do not use as drugs. So in the drugs, you need to remember only first order and zero. Okay, so that is the basic difference. In first order, rate of elimination is directly proportional to plasma concentration, whereas in zero order, it is constant. Okay, now second difference. What is clearance? Before going to second difference, you need to know what is clearance. Clearance means how much plasma is cleared of the drug per unit time. So how much drug plasma is cleared, or simply how much drug is eliminated. So the formula of clearance is rate of elimination per unit plasma concentration. So clearance is calculated as rate of elimination divided by plasma concentration. So rate of elimination we have already calculated in this. So if we divide it by corresponding plasma concentration, it will become clearance. Okay. So rate of elimination here is 50. Here rate of elimination is 25. Here it is 12.5. Here it is 2.5. And if we want to make clearance, we will divide it by corresponding plasma concentration. Plasma concentration at this point is 100. At this point, plasma concentration is 50. At this point, it is 25. At this point, it is 12.5. So this become clearance. And if we note 50 by 100 means 1 by 2. 25 by 50 means 1 by 2. 12.5 by 25 means 1 by 2. 6.25 by 12.5 is 1 by 2. So what we noted that clearance is constant in first order kinetics. First order kinetics, clearance is constant. So if you see in first order kinetics, clearance of a drug remain constant. Whatever may be the plasma concentration, clearance is constant. On the other hand, in zero order kinetics, if we calculate rate of elimination, we have already recorded. If we divide by corresponding plasma concentration, it becomes clearance. So plasma concentration at this point is 100. Here plasma concentration is 80. Here plasma concentration is 60. Here plasma concentration is 40. So 20 by 100 means 0.20. 20 by 80 means 1 by 4. 1 by 4 means 0.25. 20 by 60 means 1 by 3. 1 by 3 means 0.33. 20 by 40 means 1 by 2. 1 by 2 means 0.50. So what we noted, clearance is different at different plasma concentration. More plasma concentration, less clearance, and less plasma concentration, more clearance. Or we can say in zero order kinetics, clearance is inversely proportional to plasma concentration. More plasma concentration means less clearance, less plasma concentration means more clearance. Clear? So this can also be asked in the form of a graph. So if you plot a graph between plasma concentration and clearance. So plasma concentration and clearance. So plasma concentration I will write here, clearance I will write here. In case of first order kinetics, we know clearance is constant, whatever may be the plasma concentration. So the graph will come like this. Whatever may be the plasma concentration, clearance is constant. So this is first order kinetics. Clearance, suppose this is any particular value, it will remain same whatever may be the plasma concentration. If we want to know same thing in zero order kinetics, what is in the zero order kinetics? It is inversely proportional. Means when plasma concentration is high, clearance is low. When it is low, clearance is high. So in case of first order kinetics, it can be graph like this. At low plasma concentration, clearance is high. High plasma concentration, clearance is low. So it is zero order kinetics. You understand? So first order kinetics horizontal, zero order kinetic not horizontal. Okay. So that is about second thing, clearance. Then moving to third thing, half-life. Half-life also known as T half. So half-life, we know it is a time in which plasma concentration become half. In how much time plasma concentration become 50% is called as half-life. So if we see half of 100 will be 50. So how much time it take from 100 to 50 will be half-life. So 50 is here. So we see that from 100 to 50, this is half, and the time taken will be half-life. So what is time taken here? It is 1 hour. So half-life at this point is 1. If we see here, half 50 is there, half of 50 is 25. So how much time is taken from 50 to 25 will be half-life, and half-life at this point also is 1 hour. Similarly, 25 to 12.5 also take 1 hour, and 12.5 to 6.25 also take 1 hour. So what we noted that it takes only 1 hour to make it half. So half-life is 1 hour everywhere, whether the plasma concentration is 100 or it is 12.5. So half-life in case of first order kinetics is constant. Half-life is constant. Okay. Now we see the same thing in zero order. Initial concentration is 100 and half of 100 is 50. And if we see 50 will be somewhere in between 60 and 40. So the time taken from 100 to 50 will be half-life. So how much time is taken? 100 to 80 takes 1 hour. 80 to 60 takes 1 more hour. And 60 to 50 you can say around half hour. So the half-life at this point is 2.5 hours. You understand? 2.5 hours. Now if we place here plasma concentration is 80. So half of 80 is 40. So 40 is here. So the time taken from 80 to 40 will be half-life. And how much time taken? 80 to 61 hour. 60 to 41 more hour. So the time taken here is 2 hours. Okay? So time taken from 100 to 50 was 2.5 hours. But from 80 to 40 is 2 hours. Similarly, if we take at this point 60, half of 60 is 30. So 30 is between 40 and 20 here. So time taken from 60 to 30 will be half-life. And how much time taken? 1 hour from 60 to 40, half hour from 40 to 30. So it will be 1.5 hour. 1.5 hour. Similarly, the time taken from 40 to 20 will be half-life. And it takes only 1 hour. So what we noted? At high plasma concentration, the half-life is more. At low plasma concentration, half-life is less. So we can safely say in zero order kinetics, half-life is directly proportional to plasma concentration. Okay. So 4 important differences between first order and zero order kinetics. In first order, F means fraction is constant. Zero order, it is not constant. In first order, clearance is constant. And half-life is also constant, but in zero order they are not constant. Clearance is inversely proportional and half-life is directly proportional to plasma concentration. Now without making this mathematical thing, you can also answer these questions. Just apply the brain little bit. So if we see that clearance, and first of all, fraction, we know fraction is constant. When fraction is constant, so 50% fraction will also be constant. So if 50% fraction is constant, 50% means half. So half-life will be constant in first order kinetics. Clear? Because 50% is constant. Second thing, we know that in zero order amount is constant, first order percentage is constant. If the amount is constant, you can safely say that amount is constant. That means particular amount is removed per unit time. So suppose we say initial concentration is 100. So from that 20 will be removed. So out of 100, if 20 is removed, 20% is removed. But if out of 40, 20 is removed, 50% will be removed. So at lower concentration, more will be removed. So clearance is inversely related. More concentration, less clearance, less concentration, more clearance. Is it clear? So less concentration, same amount is going. So percentage going will be more, so that means clearance will be more at lower concentration. On the other hand, it will be constant in first order kinetics. Okay, so that is the basic mathematical differences, 4 differences. Now almost all drugs follow first order kinetics. Almost all drugs follow first order kinetics. One drug which follow almost pure zero order kinetics, it is alcohol. Alcohol is the drug which follows almost pure zero order kinetics. Like in alcohol, we have 100 to 50, 50 to 25 to 12.5. It takes same time. So that means rate of elimination is constant. Rate of elimination is constant. So that means do not take same time. So in case of alcohol, sorry, I made this wrong. Remove this. In case of alcohol, rate of elimination is constant, and you can assume that around 10 gram alcohol is removed per hour. So what is the clinical utility of this? You can utilize this practically. So you know that every hour 10 gram will go out of your body. So now you can safely see that when you are sitting in a bar, you will calculate how many packs you have taken, and after how many hours you have to go home. Otherwise, your mummy will smell you and then you will get caught. So that is the practical utility. In drug following zero order kinetic, it is the amount which is constant, not percentage. Okay. Now there are other drugs also which follow zero order kinetics. They are usually called as pseudo zero order kinetics. We will discuss pseudo zero order also, but just remember here, normally we consider all of them to be zero order, and these are remembered as 0 watt power. Like we have 0 watt bulb at the home, so 0 means zero order kinetics. W stand for warfarin. A is alcohol, and also A for aspirin. T is theophylline. T is tolbutamide, and P is phenytoin. So these are the drugs which follow zero order kinetics. Drugs following zero order kinetics. Okay. Now question is, why some drugs follow first order kinetics and why other drugs follow zero order kinetics? On which factor it depends whether a drug will be following first order kinetic or it will be following zero order kinetics. ये किस चीज पे depend करता है? Clear? So for understanding that, we'll try to understand one simple thing. Suppose this is a drug and it is metabolized by a particular enzyme. So this enzyme will break this. Normally, for most of the drugs, the enzymes are surplus. The meaning is, suppose we are giving 100 molecules of drug from outside, but already in the body we have 1 lakh enzymes. 1 lakh enzymes are already exist. This is a general method to understand. So if we give 100 molecules of a drug from outside, all 1 lakh enzyme need not work. So only 100 enzymes will come and they will attack the drug. Suppose they can break half of the drug in 1 hour. So they have broken 50% of the drug in 1 hour. Okay. Now, if instead of 100, we increase the dose to 200. So now the number of enzymes will also increase. So now the 200 enzyme will attack. So again, they can break the same fraction in same time. If we increase the dose further to 500, then 500 enzymes will start working. Again, they can break same percentage in same time. So this will keep on happening. If we give 100,000, that means 1 lakh drug molecules. Now all 1 lakh enzymes will start working. And they will also break same percentage in same time. So that means till the time number of drug molecules are less than number of enzymes, it will be metabolized to same percentage. So that means it is following which kinetic? It is following first order kinetics. But now consider if we give more than 1 lakh. If we give 2 lakh or 3 lakh or 10 lakh, now the enzymes are only 1 lakh. So they can break a particular amount in per unit time. So they cannot break more than 1 lakh. So now the amount become constant because the enzyme become the limiting factor. They can break only 1 lakh, even if it is 100 lakh, but they can break maximum 1 lakh. So now the amount become constant. So it start following zero order kinetics. So you understand the difference? First order kinetics will be followed when the number of enzymes are surplus, not limiting, but zero order when the enzymes become the limiting factor. So that's why it is also known as saturation kinetics. So we can say that the enzyme have become saturated. So that is known as saturation kinetics. So number of enzymes have become limiting factor. Now the question is, at any particular dose, sometime there will be more drug than the number of enzymes. So number of enzyme will sometime become lesser. So even if we are giving 100, it is number of enzymes are less. But whenever we give more than 1 lakh, we give 2, 3, 4, 5, 10 lakh, if it will sometime will become higher than the number of enzymes. So that's why any drug can follow zero order kinetic at high doses. So at low doses, the drug will follow first order kinetics. At high doses, it will follow zero order kinetics. Then why we are saying that these drugs follow zero order and rest of the drugs follow first order? So we will be looking at what therapeutic doses we are aiming to give. Okay, like suppose in this example, the dose of the drug was 100 molecules. So when we give 100, it will follow first order kinetics, and we are not mad to give 1 lakh. Obviously, we want 100, so we will give 100. So that means at therapeutic doses, which kinetic a drug follow, we will label the drug to be following that kinetic. Clear? Now, suppose there is a drug whose plasma level we require is 5,000. Drug required is 5,000, but the enzymes are only 1,000 in the body. So whenever we give 1,000, it will start following zero order kinetic because 5,000 molecules are more than the enzymes. So enzyme becomes saturated, so it is following zero order kinetics. Now this drug will be metabolized. Particular amount will be broken. So keep on decreasing. But at one time, it will become less than 1,000. So whenever it becomes less than 1,000, enzymes are not limiting anymore. So now it will start following first order kinetic. So any drug which follows zero order kinetic at therapeutic doses, whenever the plasma concentration become very low, it will automatically change to first order kinetic. That means almost every drug which follows zero order kinetic at low doses will be converted to first order kinetic. So that's why zero order kinetics are usually not zero order. It is usually called as pseudo zero order kinetic because at some point it is definitely going to change to first order. Alcohol is the one at which very low doses it will convert to first order. So we assume it is following almost always zero order. But most other drugs, they start with zero order. At low doses, they will go to first order. Clear? So any drug at low dose can follow first order kinetics. Okay. Now the practical example, the clinical example to understand first and zero order kinetics is aspirin. Now, we all know aspirin has several uses. Dose dependent uses. The uses of aspirin include antiplatelet use, antipyretic use, or for fever we can use it for fever. It can be used as analgesic for treatment of pain, and it can be used as anti-inflammatory also. So these are the different uses of aspirin, dose dependent uses. Okay, antiplatelet action is at a very low dose, antipyretic slightly more dose, analgesic slightly more, and anti-inflammatory still. Okay, now to understand this, make the concept, suppose the enzymes to metabolize aspirin in the body are 2,000 enzymes are there. Antiplatelet action occur at 500 molecules. Antipyretic action occur at 1,000. Analgesic action occur at 1,500, whereas anti-inflammatory dose require 3,000 molecules. That's just to make you understand. So if we use aspirin as antiplatelet drug, which kinetic it will follow? अगर हम antiplatelet use करते हैं, तो which kinetic it will follow? Tell me which kinetic it will follow? Yes. Yes, it follow first order kinetics. First order kinetics because enzymes are more than the number of drug molecules. Now, if we use it as antipyretic, which kinetic it will follow? Still the number of drug molecules are lesser as compared to enzymes. So still first order. If we use it as analgesic, which kinetic it will follow? Still first order because number of enzymes are more. But if we use aspirin as anti-inflammatory, number of drug molecules are more than enzymes, so this will start following zero order kinetics. Okay, so aspirin has a dose dependent effects. At anti-inflammatory doses it follows zero order kinetics, whereas at other doses it follows first order kinetics. But even aspirin, when we use as anti-inflammatory, after some time it will be metabolized. So from 3,000, it will sometime become less than 2,000. So whenever it is less than 2,000 in this example, it will also start following first order kinetics. So therapeutically start with zero order, but at some point it will be shifted to first order kinetics again. Okay, so that is the basic crux of first order kinetics and zero order kinetics. Clear? So any problem in understanding the concepts of first order kinetics and zero order kinetics? Now we can discuss some type of questions which can be asked. So simple mathematical question if we see from first order and zero order kinetics. So they can say that we have given a particular dose. Suppose we have given 1,000 milligram of a drug. 1,000 milligram of a drug, and out of this in 1 hour the plasma concentration become 800 milligram. So not plasma concentration, the drug remaining in the body become 800 milligram. Clear? Now, whether the drug is following first order or it is following zero order, that will change the answer. Now the question is, how much drug will remain after 3 hours? After 3 hours, how much drug will remain in the body? So what is the difference is, if the drug is following first order kinetics, the fraction is constant. Okay, so that means out of 1000, if 800 milligram are remaining, that means 20% is removed. 200 milligram means 20% is removed. Clear? So that means after 1 hour, the remaining is 20% of 1000, that means 800. After 2 hours, 20% of 800 will be removed. So what is 20% of 800? So 160. So remaining will be 800 minus 160. That means 640 milligram will remain. Okay. Then after 3 hours, what will be there? 20% of this will be removed. So 640, 20% is 128. So remaining will be 640 minus 128. So it will be 412. You understand? So if it is following first order kinetics, it is percentage which is removed per unit time. On the other hand, if it follows zero order kinetic, it is very simple. It is the amount. So we see that in 1 hour, 100 minus 1000 minus 800, that means 200 is removed. So after 1 hour, 200 is removed from 1000, it become 800. After 2 hours, 200 out of 800 will be removed. So remaining is 600. And after 3 hours, 200 out of 600 is removed. That means it is 400. Clear? So that is the basic difference between the first order kinetics and the zero order kinetics. Clear? So that completes the topic of today, that is first order and zero order kinetics and the concepts related to that. So if you have any more questions, I'm here to answer. So any questions, guys? Okay. So if you don't have questions, I think we can stop. So I'm here if you have any more queries. Yes, aspirin. If you see aspirin, I was telling just an example to show that aspirin has dose dependent effects. It has dose dependent effects. At low doses, it will follow first order kinetic. At high doses, it will follow zero order kinetic. So if at therapeutic doses, a drug is following zero order kinetics, we say it is following zero order kinetics. Yes, you are absolutely right. Okay. So any more queries? Yes, beta, we already told that in case of first order and zero order kinetics, in first order kinetics, we told that half-life and clearance is constant. Clearance and half-life is constant in first order kinetics, but they are not constant in zero order kinetics. Okay. So any more doubts? So I think we can stop this lecture here. So if you have any more doubts, I am available on Telegram. So you can ask me there, or you can ask me via my mail ID also. Okay. So thank you very much, guys. It was nice interacting with you. Thank you very much.